So, we are here today talking about how to be healing centered versus trauma informed. And this is our October webinar. I am super excited to kind of get into this content. It's some of my favorite content to talk about. And I feel like we don't do enough around talking around what it means to be healing focused. We know a lot about trauma. And to that point, I always start with a quiz. So you do not have to, this is, you can put this in the chat, or you can, um, go ahead and I'm trying to invite people let people in at the same time. Um, you could come off mute if you wanted to answer the questions. It's not going to be that hard, okay? But I like to start with the quiz just to get us started. So the first question is, at what point in a person's life do traumatic events take place? Between the ages of 0 and 3, between the ages of 3 and 9, between the ages of before 18, after 18. Okay, great. I've got people who are saying any age, any age. Right, okay. So anybody else want to add? What else are this is a quick quiz. Yeah. So, yes, we know that trauma can happen at any age. We do know, however, that traumatic events that happen when you are very young, so the ACEs has an incredibly impactful sort of foundation in who you are. It also is also an opportunity where we can do more to help support people, and not create the environments in which they are being impacted at such a long age. All right, second question, true or false? Trauma-informed care refers to the prevention, intervention, or treatment services that address traumatic stress as well as any co-occurring disorders. So in the chat, come off, what do we think? True or false? You're going to say trick question. No, I'm kidding. All right, yeah, maybe not sure because yeah, we want to know, okay, what do we think? True or false? True. All right, so maybe it's true, maybe a mix of each. Yeah, it's added in the chat. All right, not sure. Got it. Got it. That part of why we're here, right? So for this definition, it is true. And that one of the reasons that I wanted to raise this is that very often we think of being trauma informed as only addressing like the prevention side of things and not also talking about what we do to support people, as well as understanding that there are many co-occurring situations that are happening for people. One of the things I would add in terms of co-occurring that we want to expand is our toxic culture and social toxicity. So it's not like simply just one experience that we need to be aware of. We want to be aware of so much more than just that. One more question. So what percent of people um, who wind up in our public health systems have already been exposed to a traumatic event? So we're thinking about people who are ending up in some kind of care. What percentage have already, okay, yeah, we're good. So 80%, 90%, 100%, 70%, like what do you think? Okay, Anna says we got 80 between 80 and 100. Okay, right, right. So what's interesting here in terms of this data is that this was prior to COVID. where the numbers at that time had been 80 to 90%. So the majority, I mean, a huge majority of people. Now we have all been exposed to COVID. So that was a worldwide, right, traumatic event, which would bring, so any of us coming in, right, would be have had that exposure. But I think that the key with understanding this is that most people who are entering our systems in any environments that we're in have already been exposed to some kind of trauma at some level, whether those were ACEs, those early childhood experiences, or there's something that are more recent, we want to be aware of. My goal in working with people is to really recognize, as Samsa says here, the trauma is widespread, that we know that it is harmful, that it can occur as a result of so many different things. It's not just related to one thing, right? That trauma can occur because of violence, abuse, neglect, loss, disaster, war, and then any other kind of emotional situations that people might be going through. There are really no boundaries. And it is almost a universal experience with people who have some sort of mental health or substance use disorder. When I think of all of the experiences that people have when we talk about trauma, we also need to talk about how there's a difference in facing adversity and having it be experienced as trauma, or facing adversity and finding a way to get grounded in your strength, your hope, and your ability to push forward. Okay. So the opportunity here is to say that just because you experience something terrible does not mean that you are going to be traumatized. And just because you didn't personally experience whatever it was doesn't also mean that you don't experience trauma. Okay. What we do also want to talk about is where the resilience is and how we heal and what we can do to support that. So we're going to take a couple deep breaths in. Are we ready? I'm going to ask you to take a deep breath in and let it out. Okay, whenever I talk about trauma, I try to make sure I put in the breathing, because we're talking about things that bring up stuff for all of us. It's real, it's something we need to be aware of. Um, so for you who do not already know who I am, first, welcome. I'm Dr. Dietra Hawkins. I always introduce myself as a facilitator first because I'm really interested in helping people change what they do and not just be aware and have more information. I've been a qualitative and quantitative researcher. I think you have to have good qualitative questions in order to actually have great quantitative data. I have been working as a coach and a longtime advocate in the recovery community for more years than I want to say at this point. Um, but I am also grateful, super grateful for the work and that I've had the opportunity to do and to support communities in their wellness and healing. I am a licensed clinical psychologist. However, most of the time I am not actually using a lot of that. And I think it's important to acknowledge that our field has really done a lot of growing over the years. And it takes some time, like there's some good things that are happening. Let me just say that. I am a mom. I'm married, and I always talk about being a Black Catholic because I grew up in Memphis, Tennessee, where there were three Black Catholic churches, um, you know, among all the other Catholic churches. And the beauty of that is that they were some of the first to provide education to my family uniquely. They were also some of the last to desegregate. So a very mixed kind of history here. However, we like Pope Leo. I use the pronouns she and her. In my company, both and partners, we work on helping people get grounded in their purpose, talk about aligning your day-to-day practices and reaching toward possibility. It is too often that in our work, we focus on the things that are wrong, we focus on, the problems. It tends to be very, as I would say, trauma inducing and not so much healing focused. So we want to really focus on how we can help people be in their space of healing. And one of the first things I want to say is thank you. Just a lot of gratitude for being here. We're also getting ready to have Halloween. in All Souls and all the other things that are coming up. So I just wanted to start off by saying thank you. One of the strategies that we can all start to do more of as we are working in a more healing centered way is to start with being in a place of gratitude and practicing making sure that you have some gratitude practices. Okay, so we are going to do our first breakout room. And this is pretty simple. I try to help people have community with other people. And so I am going to invite you into a breakout room with another person who's here just to say what's brought you here? What got you to sign up for today? What is it that has brought you here in this moment to think about being trauma informed? I mean, talk about healing centered and trauma informed, and just how you came to be here. So, I'm creating the rooms. There's about 3 people in a room. I'm going to give you 6 minutes or so in that breakout room, and then we're going to come back and we're going to dive into the content. Okay? Opening the rooms right now. Everyone, welcome back. Welcome back. My goodness. I'm like trying to make sure I'm getting admitting everybody. Did people get a chance to talk? Okay, so um anybody want to share a little anything you noticed about like why you're here?
We were all interested in how we can better help people and serve people.
That is awesome. That is awesome. And we do need to find there are ways that we can do things so much better. And at least one of the things I'm coming to is that like there's always new information and I never want to think that I'm like the smartest person in the room. One of the reasons I like to do what I do is that there are so many people doing great things and we need to come together and share those stories and find ways to amplify and grow and support each other in what we're doing. So it's not like we need to be doing things by ourselves because it just isn't how things really work. And to be successful, to have the continuation, to have the growth that we want, we need to come together. So an idea, if you're open, is to drop where you are in the world here, because we do end up having people from all different parts of the country who join us. So add that in the chat. Would love to get an idea of where people are joining in from. As we've got, I'm based currently in Atlanta, but I know we have folks who are um, all over. So Cleveland and Atlanta, and we'll have Mexico. That's amazing. I mean, we're just gonna have people from everywhere. So let me cover a couple things. This is a topic that I actually do quite a lot of work on, but I'm in today decided to focus on sort of 3 parts instead of like all 8. And to start off with, to welcome, I want to share some frameworks that I think help. And then I want to make sure that you know that we have leadership intensive that is starting next week. And for people who are signing up today, you'll get a special one-on-one with me, in addition to participating in the intensive. So make sure that you pay attention to that and hop on that. So before I generally do almost anything, it does cost money, but if you need help, reach out to me. We often have people who might help support that and sponsor it. So don't let that be a barrier for sure. We are able to offer continuing education credits for people participating. So that's also something to just kind of be aware of. Okay, so most people know that when I start all of the work we do, we talk about first we have to start with hope. So I begin by sharing my basic tenets because I think it's a practice that we all need to share with each other on how you're showing up. And so my first part is to say I always think about hope, One of my favorite things is to recognize that stories are so much more powerful than facts. So the way that we connect with each other makes a big difference. Be really good as a storyteller. That's what we do in our TLC work. I recognize that we're all in a cultural context, so we're joining from different places. We might be, oh, I love this. We're all joining from, but some of us have connections like different parts of the world. I know I have a Connecticut number, but I live in Georgia. Um, it's important that we give ourselves a bit of grace, meaning that we are always going to be in a process of growth. Okay. I think it's so important that we are recognizing that we need to be aware of our filters and how sometimes we're getting information and it's not feeling so good. So we're kind of blocking it out. The other piece with that is that other people's filters we're going to be hitting up against filters. And my thing is join a community so we can clean our filters because sometimes we have to stop and do that so we can let the good stuff come in. Too often you go places where you learn how to work with particular people. So when we're being healing centered, one of the first things you're going to do is actually focus on yourself, right? We're going to make sure that you know how to do self-regulation, that when we're thinking about being healing and focused, that we are practicing those things ourselves, that we are not just focused on working with other groups. We know that stereotyping is part of what our brains do. Just read some interesting research to just drop a little piece in here. I'm always reading a new book. If you have not read this book, it's called When We Walk By. And one of the pieces that it talks about is how in our brains, when we see a person who is without a home, we actually, our brain registers them at the same place that we register things of disgust. Unbelievable to me. Unbelievable. So what is that saying? That means that the way our brain initially registered something, we have to find a way to pause and see them as a person and actually pay attention to them. And so there are ways and things that we can do to build that in, and that we need to recognize that there's a lot of stuff. There's so many things our brains do that without our permission, and we just need to find ways to work around it, which is what we do, and are also kind of, having to work around some other things because of the way our phones work. That's a different story for another day. We all have a role to play. Key thing for me in everything that I do is to make sure that you know that I am not here to try and assign blame. Scapegoating is not what we need to be doing. Okay. All that does is allow the status quo to keep going. So that is not what this information is about. That is not what I'm about. This is what we're trying to do is make sure we're doing that. And the first thing for everything is to show up. Even if you don't think you have anything to contribute, ask, show up, be present. It's amazing. It's very healing. That's what we need to do. All right. So if you are not familiar with Tarana Burke, anyone here know who Tarana Burke is? Anybody heard of Me Too? The Me Too movement? No? Yes? Maybe? Okay. All right. Yes. She is really the originator of the Me Too movement and has a wonderful TED Talk and a couple other things, a book that recently came out that she actually co-authored with Brene Brown. But one of the quotes that I like from her is that trauma halts possibility, but movement activates it. So when we're thinking about, here, even today, you showed up, that's movement. We can move past it. We can heal. And so yes, trauma is an issue and it does hurt, but it does not mean that it has to stop our lives. So I think it's important that we pay attention to that. So if you get nothing else, I want to make sure that I have given you the things that actually help. So here are a couple things. The first is that we have to redefine basic need and not just think about our needs in terms of food. Everybody's heard of Maslow's hierarchy of need, right? We actually need to redefine it based on what he learned it from, which is the Blackfoot Nation, into belonging. Okay, the core for all things. So again, another piece just to add a component into the book that I mentioned when we walk by. What he is suggesting in that book is that actually it's more about people having a lack of relationships that has led to them to be without a home than the physical not having a home. And so I think it's really interesting because if you belong somewhere, then we take care of people, right? We see people as people and not as an object, and certainly not as something that's discussed. The second is that we need to be in community. We actually have to help our communities repair and build and create trust and find ways to talk and like come together and enjoy each other. We can do that by focusing on healing and not just trauma. And the key story that I'm going to share, I want you to think about with this is that all of us want to be known for the things that we can contribute instead of the things that have happened in which we need to be taken care of. So if we focus on healing and contribution, then that is so much more powerful than focusing on the trauma and being a victim of something. Two things that come from the healing centered approach by Sean Ginwright is talking about agency and aspirations. And there are other parts too, but I'm focusing on these two in particular because right now we need to all have a sense of agency that we can actually do something, and we need to help all of us be in a space of dreaming about what is possible. The only way we will ever get to movement is to dream about what is possible and to not just focus on the things that are in the way. Okay. How is that sitting with you all? All right. I'm going to unpack a little bit more of it. We're going to have a chance to talk through it, but I always want to make sure that I'm mentioning those core things before, going too far into things. So to remind you, take action, join our community. Again, we have our intensive coming up. That is going to be live. This is actually we've been offering for the last couple of years a transformational leadership cohort that was over 6 weeks. This is compressed. It'll be over 2 weeks, 4 intense sessions, and live. So you don't have to like go and watch videos and then be prepared and all of that sort of stuff. We're just going to do it all together. Okay. So one of my favorite TED Talks, Kristen Mail, talks about the role of food banks, something we probably all are very much thinking a lot about right now. And what she shares here is that what's really important, not only in providing having a food bank, but is really talking about the importance of community and belonging. So one of my favorite stories that she shares in this TED Talk is about these kids. How many people we're getting ready to have the holiday time, and people do the Christmas tree or the wish list. And there are families, she says this, there are families who go and they pick something to get a family, get a kid for Christmas, and then they judge what the kid wants. Like they might want Nike shoes or Uggs. And the families will say, well, I don't, I can barely afford this or that or whatever. We make a judgment about what people should want. And the reason that I bring this up, because this was actually a eye-opening for me. I mean, for me as a parent, because at this point in time, I was like, my kid was like fussing with me about wanting an iPhone. And I was like, why do you need an iPhone? Okay. As long as you have a phone, you're fine. What we don't know is that the kind of phone you have, the kind of shoes you have, the kind of bag you have indicates, do you belong or not belong? Okay. So I'm going to tell you my story. My kid is in the back of the car with four of her other friends, and they're ragging on her about not having the latest iPhone, so she can't join the game that they're all playing. This was like getting ready to go into COVID. And it helped me be like, oh, she's actually not able to belong because she doesn't have the tool to belong. So when we think about things, I just want us to think about judgment. I want you to check out this TED Talk. I want you to see where we are putting a judgment on whether or not someone should have this or that. And instead of thinking about the basic needs, right? The basic need is to belong and not have that stress. And then if you can just show up, then you can get about the business of doing the other things you're trying to do, like go to school and learn. So it's interesting because it's very timely for the kinds of conversations we're having right now, where there's a decision about what kind of food you can have and how you can use your resources. And all of us need to have spaces in which we can be really fully ourselves. So I always try to make sure that I mention that Maslow's hierarchy of need, there was a article that came out, this is now in 2008 or so, that acknowledged that it was all learned from the Blackfoot Nation. And that the piece that was missing, which is one of the reasons why, if you look at all the research, Maslow's hierarchy of need doesn't actually work, is because community. It's all about context of community so that you can actualize yourself. You cannot know yourself by yourself. You have to have others to know yourself. So, when we think about one of the first things to be healing centered and to address trauma, one of the first things we can do is to actually find ways to create environments for people to really belong and to take notice of what those things are. You know, what is necessary in this community to belong, to like have the entryway. And every community is different. So there's times when it's like, for Black women, it could be our hair, and being in a space in which we can actually celebrate our hair. That would be the crown movement and making sure that that makes sense, that it's okay that we do whatever we need to do with our hair. Um, but it's all the different things. So I want to make sure that I am making a point about that. And oh my gosh, the time is going faster than I thought. Okay, so community, we want to make sure that we are fostering strong social connections, that we find ways to promote participation in different community events. So I wanted to invite you in chat to say, what are you experiencing in community right now? Is it distress? Is it isolation? Sorrow? Yes. Resentment? Yes. Yep. A lack, yeah, the basic needs, right? I mean, we're seeing lines of people who our government is shut down, isolation, people aren't able to get the resources that they need. Definitely. Yep. There's so much. Um, just what, maybe a year ago, the Surgeon General's report came out talking about our epidemic of loneliness in our country. And we're supposed to be the most connected ever, and yet we're really not. So there's like a lot of things. So I just want to thank you for showing up today. This is why we have to do this, right? Yes, communities experiencing crime, and then there's a whole lot of other things. And we're just like, what we're seeing everywhere. My daughter was sharing a story about the police being called on someone who they thought was stealing a bag of chips at a Panera. It's like amazing, just amazing, all the different things. Yeah. So yeah, yeah, yeah. And how to connect. It's just hard to connect. I think there's a lot of fear, a lot of anger. What I would also wonder is, are you noticing any of these kinds of symptoms? Is there a sense of kind of hypervigilance, self-silencing, mental distancing, doom scrolling, media overload? Okay. Yeah. Yeah. So isolation. So we're describing symptoms of trauma, right? This is what we're talking about. Like that's why we're here. And I think it's important that what I want to highlight is that there is something beyond just thinking about trauma that happens to an individual. That what we don't do enough of is talk about our community collective experiences of trauma, right? And then what we need there is then a community experience and process for healing. Okay. So we're going to breathe. I'm going to invite you to take a deep breath in, and you're going to let it out. We're going to do that one more time. Take a deep breath in. And we're going to let it out. Believe it or not, some things that will help us: collective breathing, collective dancing, music, taking a moment to disengage in some ways, right? Just slowing it down, just slowing it down so we can really remember what's really important in who we are and what our resilience really is, because the resilience is there. The strength is there. One of the first things we can do is just name what we're experiencing. Just give it a name. Just say what it really is. One of the first things. Other things that help, right? Community. We have to find ways to build empathy and repair trust. I'm saying that like it's easy. We do a whole thing on trust. It's like deep. You get all kinds of things. We got to go into that. But I think it's important to at least acknowledge that and start to ask questions like, what could that look like? What do we actually expect? Where would we find that? How will we know? These are my favorite questions. We need to help our communities come together and learn the skills for how to actually listen. So I am often, especially with our TLC, saying, don't just come by yourself. Try and bring somebody else with you, because you have to have a place to practice. You have to have other people with you who also are hearing the same information and able to help you stay accountable to what you're learning. That's what we do at peer support. And if you're curious, a couple of programs that I've helped support is called the Amani Breakthrough Project. Great program that is centered in churches, that brings peer support, addresses mental health and substance use, teaches skills, aligns all the process actually with language from the community as they want to see it. It's phenomenal. So really great outcomes. If you want to know more, reach out to me for that. I am a huge fan of Dr. Sean Ginwright and healing centered engagement. I became a certified engagement specialist as part of his program. And one of the things that I love, in addition to his book, The Four Pivots, and really helping us remember to get out of the hustle and get into flow, is centrally in a trauma informed approach, which is not to say there's something wrong with being trauma informed. It's just saying that we need to do more. Okay. That what we did do, which was good, is instead of saying what's wrong with them, we said what's happened. That's what, so we started off with what's wrong, which is, so trauma informed got us to what's happened. That's good. That's good. It's important. Okay. And now we want to say what's right. Okay. You get me on that. So this is a continuum. We went from the trauma, which is what's wrong with them, to trauma informed now, which is what happened to them. And now we're being healing centered, which is to say what is right with you. Okay. That you can be a full person and not just one thing. And that's really what we're getting at here, is that too often in our trauma informed process now is that we really just we try to center it in on that one thing, right? We tend to think about this in a very clinical way. And we're treating people instead of communities. And so when we think about being healing centered, we're going to focus more holistically. We're going to really think about, sometimes there are changes that need to happen institution wise. Sometimes there are changes that need to happen policy wise. Sometimes we need to have the communities be the ones that are informing and creating that. So we're recognizing the environmental traumas that are in the context in which they happen, not just that isolated event. And we're also providing support to the providers. Okay. Because if we're not well, what can we do? for everybody else. Oh my gosh, this is huge. So I am such a like, we've got to be able to move in this direction and recognize the both and of this. Of course, that's going to be my bias, but there's a reason that my company is called both and. So a couple things to highlight, and then I will get some thoughts from you. Agency, right? So one of the things that we talk about from a healing centered perspective is focusing on agency, this ability to act and create change, to address those root issues, to invite people to say, like, how are you getting involved? That we actually have a role. If you're a provider, you're supporting people in communities, of saying, in what way are you um, wanting to be part of activism? So one of my things back in the day used to say, like, "Has anybody here participated in a protest? Anybody here ever voted?" That is a form of protest. It is also a sign of love. Okay. We can, in lots of different ways, if it's just naming things correctly, right? Being able to say what we actually see, how does power actually work? So in the intensive, we will talk more about the role of power to and power with versus power over. And I am a big believer that if we can all start to be clear about what we mean by power, because we often self-silence ourselves because we don't think we have power. But we do have power to and power with. And many of us are shying away from power over, which is coercive power. And so it's completely understandable around that. But our activism is one of the ways that we can build this out. Is this resonating with people? I hope on some level it is. Okay. The next part is aspirations. Now, it takes bravery to aspire, it takes courage to dream. And yet, that is absolutely what we need to be able to focus on possibilities, help people to dream, say what one small part of that dream could we put in place right now? Maybe it's not everything, maybe it's not for an hour, but maybe it's just 10 minutes. Maybe we can have 5 minutes of peace, right? Maybe we can embrace those few minutes of joy. These are the things that we can do and we have to aspire to do, and then do more and more and more of it. The resilience is there and we can do that together. So in summary, because I try to make sure I am cautious of your time, and I would love to answer questions and hear what is resonating with all of you, is that I want us to find ways to redefine our basic needs and start with belonging. Okay. Start with the signs of belonging. Build community. So join a community, invite people in, talk with me about how we can support you in that. Cultivate agency. Take time to discover what your aspirations are and one little thing you can do to start moving in that direction. Okay. And join our TLC intensive. We're going to have some other things coming up too, actually. But I hope that you'll take a moment for that. So, again, if you do join, you'll get that one-on-one with me. And to remind you, this is what we can do. We can start with ourselves. You can ask a different question. Remember that continuum. So we're not saying what's wrong with you anymore. we're also recognizing we are going to ask what happened, and we're going to ask what's right. What do you want to contribute? What are you good at? What are your gifts? And then we can practice having these uncomfortable conversations and make sure that you invite other people to join you. All right. So what is resonating? Questions? You can come off mute.
A lot of people could use this in all aspects of life and in the world. This is much needed in the spiritual sector,
Mm,
especially in these days and time, because that's where where a lot, one of the biggest different communities are,
mhm.
which are divided silently.
Yeah. Hmm.
And there's a lot of hurt, trauma, and pain that goes unaddressed, and people's souls are at stake. And this is right on time for me, um, because a lot of people are ready to walk away
Mm,
from a lot of things because their peace is at risk.
yeah. Hmm.
And there comes a time when you have to make a choice. And that it's not a choice that you want to make, but it's a choice that you have to make.
Yeah.
A lot of pain there. And a lot of people, especially here in America, are experiencing that daily.
Yeah. Hmm. Yeah. We could go. It's a whole nother
Yeah,
question.
yeah, we got to work on
The,
some
the
of this.
pain, the pain part is so important to me because our culture has tried to teach us to not have pain, to numb pain, to it's like the one thing, and yet people who are born without the ability to have experienced pain die very quickly. And one of my pieces in my coaching with people is to ask the question, what is it telling you? What is this pain telling you? And I'll say this on a very basic level. I was an athlete for a long time. And so I was conditioned to like work through pain until I started having foot pain. And then the podiatrist said, no, no, no. When your feet hurt, you're supposed to stop. I didn't know that.
Mm,
I didn't understand. Like, oh, I'm supposed to like work through this. I need to slow down. I got to rebuild some muscles and these different things, all kinds of crazy stuff that I had to go through. But when I think about that and just our culture, right, and the pain and just that conversation, and sometimes, very often I do this, right? I'm imagining that the conversation is going to be so much more difficult than it actually ends up being.
exactly.
Our imaginations are great
Mm,
until they're not.
right.
until until they get in our way. And so I find that there's something about, really paying attention to that.
Exactly.
Yeah, yeah, yeah. Yeah.
Mm,
Um, as I've said publicly and then testimony, this is terrible.
Is there anything else anyone wants to say before we close out and I let everybody go? No? All right. Well, I am super grateful that you all have joined us for today, and our conversations will be continuing. If there are topics that I have spoken on before and you would like more, tell me because I love being able to share. And my goal is to make it accessible. So I hope that I've not used language that is not accessible, but to really
yeah.
make it accessible and very practical. So um, I hope that some of you will get to join us next week, and I look forward to connecting with you all in the future.
Thank you. Thank
Enjoy your
you.
Tuesday.
Thank you.
Thank you.
Thank you. All righty.